All right, so we're now in the second part of this lecture discussing social insurance and public assistance programs in the U.S. And in this section, we're discussing TANF, which is, of course, the acronym given to our welfare system named Temporary Assistance for Needy Families. And so we're starting with the history of TANF. And to do so, we have to go all the way back to 1935, really even before 1935. We talked briefly about the Progressive Era and all the different mother's aid or mother's pension laws that had gone into effect to care for widows and the kids that were left behind. And so ADC was the very first name, or Aid to Dependent Children was the very first name given to our welfare program in 1935 as part of the Social Security Act. And so what that legislation did, it essentially codified or consolidated all the different state mother's aid or mother's pension programs into one national program called ADC. And so the initial intent of this legislation was not that it would be a program that we use indefinitely into the future, but that we would just use this temporarily while the economic conditions weren't so great. Recall we're talking about the Great Depression era. And so it was thought that over time we would implement an additional component, another component of our Social Security system. We would add a survivors component, and that our welfare system would simply wither away. But of course, that's not what happened. By 1939, Congress had implemented a survivors insurance component to our Social Security system. That S that we saw before in the way of old age survivors disability insurance, that was originally added in 1939 as a way to do away with our Aid to Dependent Children program, but Dependent Children program. But of course, that was not the case. We still have welfare today in the form of TANF. Now, we've had different ways of administering the program in terms of the relationship between the federal and state governments. Usually the federal government will support a certain percentage of the cost of administering the program. So historically it's been anywhere between 33% at the commencement of the program in 1935 and then later in 1962. This cost sharing arrangement between the federal and state governments was shifted to a larger percentage, anywhere between 50 to 80%, and that formula is based on state wealth, was based on state wealth. So wealthier states would receive lower contributions, so closer to 50%, and so less wealthy states would receive greater federal contributions. That's a formula that we still use for our Medicaid program, but as we'll see here, this sort of arrangement was replaced in 1996 with a completely different financial arrangement between the federal and state governments that's known as a block grant. And so we'll talk about that in a second here. All right, so I had noted before in the previous slide that initially we thought that ADC would simply wither away. Congress didn't want to administer a welfare program, that it didn't reflect our core principles of hard work and such, that we should provide assistance through an insurance mechanism, that people should contribute to get something back. But you see here, that's not the case, right? So the number of recipients in the way of welfare assistance keeps escalating over time. In the 1950s, we're reaching 2.2 million. By 1970, those numbers are much higher, 7.4 million individuals in the U.S. receiving welfare assistance. And so recall that we have numerous concerns with poverty policy over the years, as noted by David Elwood. It's not just about addressing poverty, but there's a concern that people aren't working as hard if they're receiving government assistance. So one of the first major efforts by Congress to address the work effort, in other words, another way to think about it is in terms of addressing the dependency issue, was in 1967. We've talked about the earnings disregard. This was the very first historical disregard that we implemented in the way of 30 and a third, right? So very famous line. So the 30 and a third disregard, meaning the first $30 was disregarded when calculating the welfare benefit, and 33% of remaining earnings was disregarded in the way of that calculation. And so that was sort of a lenient way to get people off the welfare rolls, right? To discontinue their receipt of welfare assistance, to get people to work. Now, Congress had a much more stringent side to this. They also said that if you were found to be job ready, so the exact language was, if you were found to be suitable for work, then you must have been engaged in some type of work activity, or you were kicked off the welfare rolls. So Congress took both the carrot approach and a stick approach in the 1967 amendments. But as we saw, the welfare caseloads just continue to rise. So Congress is being both nice and strict in the way of trying to get people to work, making sure that we're not just giving people a handout, but that people are working in the process. But the welfare caseloads continue to rise. So by 1980, Congress is getting a lot more strict. They're getting certainly less generous in the way of the earnings disregard. What was once a 30 and a third disregard, Congress scales it back to just $30 in the first four months of welfare receipt. And so I'm noting here, just sort of in broad brush strokes, what the effect of that disregard change would be. So back then, the poverty line was at $517 for a family of three. And so if you were a family earning $630 at that time, you would have had your first $30 disregarded, meaning that you only have $600 in the way of countable earnings. And then, of course, with the 33% disregard, additional disregard, you get another $200 disregarded, which would leave you with only $400 of countable earnings assessed against the poverty threshold of $517 at that time for a family of three, would give you, as a family of three, $117 in the way of welfare assistance. But the quick takeaway here is that this family earning $630 at that time would have been kicked off the welfare rolls on the basis of the fact that this disregard was scaled back as of 1980. So this family is receiving nothing by 1980. And so despite these efforts, so Congress is getting more strict. They're scaling back the disregard by 1980. Despite all these changes, we continue to see an increase in the welfare caseloads. By the turn of the decade, by the 1990s, we're upwards of 11 million, close to 12 million welfare recipients. And it's not just welfare recipiency per se, but long-term recipiency. So most families who receive welfare assistance are receiving assistance for longer than 5 years. And so Congress is noting these changes, this growing dependency, as they'll frame it. And we're also starting to see some changes in the family structure, Congress is noting. And so whereas back in the 1960s, I've noted this figure before, but back in the 1960s, only 5% of all births are to unmarried moms. But by 1990, we're starting to reach upwards of 30% in the way of the percentage of births to unmarried moms. And so it's sort of this confluence of all these different factors that comes together. And so President Clinton is in office by 1992. And so by his second term in 1996, he's campaigning partly on this promise to end welfare as we know it. And so President Clinton is reelected in 1996, and he sticks to his promise. He said he would end welfare, and he does just that by 1996. He passes what's called the Personal Responsibility and Work Opportunity Reconciliation Act, or what insiders we just simply call a PERORA. And so what PERORA did was it dismantled our welfare system. Our welfare system up to that point was an entitlement program. You could receive assistance indefinitely. You could receive assistance however long you needed it. But with PERORA, it replaced AFDC. The program at that time was called Aid to Families with Dependent Children, with this new program called Temporary Assistance for Needy Families. And it's just like the title would suggest, it was now a temporary program requiring much more in the way of the work requirement. It was much more strict. It's time limited, more stringent work requirements. And it was now a different financing structure in place. We replaced that cost sharing between the federal and state governments with a block grant program. Excuse me. And so these are the explicitly stated purposes of TANF. Now, the first two you'll see here, we've had in effect throughout the years. So throughout the 1960s, all the way into the 1980s, with the more recent amendments. Certainly, one of the major objectives of TANF legislation, even back to 1935, was to help widows and to help the kids within those families. And so we've retained that initial purpose. And of course, back in the 1960s and in the 1980s, there was a major effort to try to get people to work harder, right? To get people off the rolls and to reduce dependency. We've retained that purpose historically. But by 1996, we have two new objectives here that's added to the legislation. And so the third stated purpose here has to do with the percentage of births to unmarried moms. We're trying to reduce that prevalence by 1996. And then, of course, this fourth stated purpose, which is probably the most controversial, by 96, Congress is now trying to promote the formation and maintenance of two-parent families. And so these are our actual objectives of our welfare system. it's not just about providing assistance. We have other objectives, demographic-related objectives in mind as well. So this is just a quick point about how we use that block grant, or I should say how the states use the block grant. The states will receive a lump sum payment from the federal government, depending on how much they used to spend before Perot Era. And so states can use their money. The basic point here is that states don't necessarily have to use their block grant for providing assistance to poor families. They can provide assistance to non-poor families if it's in the way of effectuating this third and fourth stated purposes. That is, if it has to do with promoting two-parent families, if it has to do with reducing the incidence of births to unmarried moms, then they can use that TANF grant for non-poor families as well. All right, I just want to cover one additional section here in this part of the lecture. So there are some major conditions that are attached to receipt of the block grants, as I was starting to allude to. So when states receive this block grant, they have to make sure certain conditions are met, certain federal conditions are met, and so we're going over some of those major conditions. There are really 5 sets of conditions laid out in the original legislation. 2 of those have to do with data reporting and such, and so I leave those out. They're not as essential for our purposes. And so I note 3 of those conditions. One has to do with eligibility requirements, the other has to do with work requirements and time limits, and then another set of conditions that have to do with what are called maintenance of effort requirements. And so we'll take a look at these in turn very quickly. So the first set of conditions, when the states receive this block grant, they have to make sure that they're following certain rules with respect to eligibility. So when the states implement their version of this TANF program, they have to make sure that everyone, every potential recipient has a minor child. So that's the first major requirement. There must be a minor child to receive TANF assistance. And then if there's a family receiving assistance, they have to assign any sort of child support payments or alimony payments over to the state. That's to defray the cost of administering this program. And then, of course, when you have young moms, the federal rules state that when you have young moms, they must live with a supervising adult, and they have to start attending school once their child reaches a certain age, and we're saying here 3 months. And then ineligibility, there are certain classes of persons who fall into certain categories that are declared categorically ineligible. So we're talking about non-citizens primarily. And anyone who has a drug-related felony, you're declared categorically ineligible for TANF assistance under the federal rules. We have some work rules in place, and most notably we have something called the work trigger rule. And this is just saying, the federal government is just saying that your state welfare recipients, once they start receiving benefits, they have to find some creditable work activity, some established work activity within 24 months of receipt of welfare assistance. So some states choose to be more strict. So some states will implement 18-month work triggers, meaning that people have to find work within 18 months of receiving welfare. And other states are more lenient. They stick to the 24-month maximum required under the federal rules. So Illinois follows the 24-month work trigger rule. And then you have some minimum work participation rates. This is at the state level, meaning that the states must make sure a certain percentage of their caseload is working at any given time. And so that basic requirement, states must make sure that 50% of their caseload is working. And in the way of two-parent families, 90% of all two-parent families must be working at any given time to receive that block grant. Some other rules here pertaining to work requirements. So I noted that you must find work within 24 months, 18 months in some states. And so when the federal government is talking about work, there are certain activities that count as work. There's more specifically, there's 12 activities under the federal rules that are counted as work, and they're prioritized. So you have everything from at the highest level of priority, you have unsubsidized employment, which is saying that the federal government or the government does nothing in the way of supporting that work financially, all the way to secondary school attendance at the lowest level of priority. And that's for young moms under age 18. They must be attending secondary school as a condition, in other words, that counts as a work activity under the federal rules. And then there are certain hours that must be met. So individuals must work 30 hours a week. And then two-parent families, you must make sure that both couples together are working 35 hours out of a given week on average. All right, some final conditions here. We have some time limits under the federal rules. There's a maximum 5-year time limit for welfare receipt. that was not in place before. You can only receive welfare for a maximum of 5 years. That's cumulative. So if you were to receive welfare assistance, go off the rolls and come back, that would accrue. And so it's 5 years over your lifetime. And there's a 20% exemption. States can exempt 20% of their caseload for hardship reasons. States can define hardship reasons differently, but most states reserve this requirement or this exception for domestic violence victims. And so in the same way that some states are more strict with the work rules, some states are more strict with these time limits. Some states implement 2-year maximum lifetime limits as opposed to 5 years. Illinois, we have a 24-month work trigger and a 5-year maximum lifetime limit on welfare receipt. And then finally, you have some maintenance of Everett rules, just basically suggesting that states must spend their own dollars. They can't just sit back and use federal dollars. They have to expend a certain percentage of what they used to spend before implementation of Perot Era. So one final note here, and that's in the way of the benefit structure. So unlike our social insurance programs, namely Social Security, which was very generous, we have automatic adjustments from year to year. In the way of the Social Security benefit, no such case in the way of welfare benefits. Generally, there's only really a handful of states that offer automatic adjustments in the way of welfare benefit levels. Of course, Illinois is not among those states. We're talking about a very stringent program here. And so where we have maximum benefits up to $2,600 for Social Security, typically for a family of 3 around the U.S., we're giving out about $350 of assistance. So this is a much more stringent program as you see here. All right, so there's, at this point, there's another section here, but I want to leave you with one final thought. If you're a serious student of social welfare policy, I think at some point you have to take a look at the actual welfare application. And so I would urge you to take a look online at the State Department of Health and Human Services and to take a look at their application. Just go through some of their questions to get a feel for what people have to go through to receive welfare assistance in the state. Okay? And so that'll conclude this portion of the lecture. Next week, we'll take up a different topic. We'll cover the healthcare system and the Affordable Care Act that was implemented in 2010.